Recently, we had a new patient visiting our clinic, an experienced nurse working in a senior home for many years. To protect her privacy, let's call her Jessica. Jessica had witnessed and worked with seniors who were sick or died from all kinds of illnesses, including COVID-19. She was managing the stress fine until she contracted COVID-19 herself. After recovering from COVID, Jessica developed a series of severe health problems that she did not expect and had to stop working. What was the final straw that broke Jessica's back? Does this have anything to do with the COVID? Welcome to Dr. Young's Health Talk. Health is our own business. I'm Dr. J.D. Young. First, let's look at what Jessica was going through. Jessica experienced a significant trauma before contracting the COVID herself, while her mother was in ICU with lung failure due to COVID-19. As a nurse and a daughter, she could not be at her bedside or visit her until she died. Like everyone else, Jessica went through an entire process of grieving, feeling shocked, angry, helpless, despair, and sad. Eventually, Jessica had to accept the reality of losing her loved one. After 6 months, she gradually calmed down and thought she had gotten over it. It was at this time that she accidentally contracted COVID herself. The disease rapidly developed into severe pneumonia with fever, cough, severe fatigue, and most dangerously, respiratory distress and reduced oxygen saturation. She ended up in ICU herself. At this time, the images of her mother struggling in the ICU and her eventual death began to flash back through her mind. The fear that herself might die overwhelmed her. Fortunately, she survived after assisted oxygen supplementation, high dose of steroid therapy, and antibiotics to combat secondary infections. Although there was still some fatigue, dizziness, and reduced concentration and memory, Jessica was gradually recovering physically. However, she developed some new symptoms that she had never had before, including insomnia, nightmares, fear of going to work, crying spells, headaches, loss of appetite, and joint pain. She had to be on temporary disability. Jessica became even more depressed and panicky because she loved her job. Besides, Jessica was a single mother. Her children had grown up and left home. She lives alone and does not have many friends or hobbies. Jessica felt her life become worthless and meaningless. She said she did not mind not waking up one morning. So what exactly is Jessica suffering? If we have to label her with a psychiatric diagnosis, I would suggest she had chronic post-traumatic stress disorder. In our later psychotherapy sessions, we found that the trauma was her fear of experiencing life and death. The process also triggered psychological trauma that her mother's suffering and death had brought to her at this time. To Jessica's surprise, the deaths of some of the patients she had cared for had a far greater emotional and physical impact on her than she had imagined. Somehow the new trauma had activated old traumas. The compounded present and past traumas completely magnify her current stress response, causing her to collapse finally. A British study found that 18% of patients discharged from the hospital had clinical or subclinical PTSD after 3 months, especially in women, and those with the past mental illnesses and the metabolic syndrome we talked about before, including obesity, high blood pressure, high cholesterol, and high blood sugar. Jessica does not have hypertension or hyperglycemia, but she was overweight, Unfortunately, obesity is not uncommon among healthcare professionals. They take care of others but do not pay enough attention to their own health. The death of families and friends due to the COVID, the social isolation, the decline in the economy, the pressure of job loss, the media-driven fear, and the improper management of government all make us feel helpless, anxious, and afraid, especially when it brings back the trauma we have experienced in the past, makes us feel overly stressed. So who is more likely to develop such chronic traumatic stress disorder? What exactly did we find further in Jessica to better understand the severe impact of her having COVID? And how did we help her? We'll continue to discuss this in future videos. Thank you for watching. Please share your experience and insights in the comment section. We'll see you again next time.